Cardiovascular disease among non-Hispanic African American population in New York. Team Project by Amber, Jacqueline, Darcy, Sabrina, and Veronica. Cardiovascular disease among the non-Hispanic African American population of New York is at a much higher rate than that of other races. Almost 40 more non-Hispanic African Americans die per 100,000 from heart disease than white non-Hispanics in New York. Reference health.ny.gov, 2010. This is a leading cause of death for non-Hispanic African Americans in New York. Reference CDC, 2012. This population is at an increased risk to develop cardiovascular disease and die than others because of the social and behavioral determinants within their communities. Non-Hispanic African American rates for conditions such as rates for lack of physical inactivity, overweight, obesity, high blood pressure, and diabetes all surpass the estimates for non-Hispanic whites. Reference health.ny.gov, 2010. Often certain populations within an area are more vulnerable to disease because of lifestyle and because of social and behavioral determinants. This is the case for non-Hispanic African Americans in New York and cardiovascular disease. The U.S. Census of 2010 reports that over 12% of the population of the United States is non-Hispanic African American. Reference U.S. Census 2010. According to health.ny.gov, African American non-Hispanics make up 14% of New York's general population as of 2010. Reference health.ny.gov, 2010. This is the largest African American population in the United States. Reference CDC, 2014. This is the leading cause of death in the United States, and New York is cardiovascular disease. Reference CDC, 2012. African American non-Hispanics in New York had the highest rate of death at 244.5 per 100,000. White non-Hispanics rate was at 2,206.6 per 100,000 due to cardiovascular disease. Reference health.ny.gov. Males died from cardiovascular disease at slightly over 32% in 2010. And similarly, female deaths due to this disease were a little over 35%. Reference nyc.gov, 2010. Almost 40% of non-Hispanics African American men greater than 20 years and nearly 45% of non-Hispanic African American women greater than 20 years in New York have hypertension. These rates are close to 50% less for white non-Hispanics in New York City. Reference Angel et al., no date. According to the Center of Disease and Control Prevention, CDC, cardiovascular disease is the leading cause of death in the United States and accounts for nearly 800,000 deaths each year are from cardiovascular disease. Reference CDC, 2012. Heart disease is caused by high cholesterol, hypertension, unhealthy lifestyle choices, lack of education, stress, socioeconomic status, lack of insurance, unhealthy living conditions, obesity, and smoking can contribute to it. Reference CDC, 2012. Most of these causes are preventable through lifestyle and behavioral changes. In the state of New York between 2005 and 2010, the percentage of prevalence of adults with cardiovascular disease was at 4.4% out of 10 on the behavior risk factor surveillance system. 2005 to 2010 with the non-Hispanic Black community in the lead of deaths due to cardiovascular disease by a 334.9 rate per 100,000 back in 2000, but luckily decreased to 244.5 rate per 100,000 by 2009. But this remains in the lead cause of death. Reference U.S. Census Population 2000. As previously mentioned, two reasons that contribute to cardiovascular disease are lack of exercise and a poor diet. In 2009, 46% of all deaths were attributed to 8 modifiable behaviors, which could have been prevented, and over 20,000 of those deaths were due to poor diet and lack of physical activity. Reference JAMA 2004 and NYS Death Data 2009. By 2009, non-Hispanic African Americans were in the lead for obesity by 30.4%, and 30.6% of non-Hispanic African Americans were reported to have no leisure time for physical activity. Reference Behavioral Risk Factor Surveillance System 2001 to 2009. This reason could be due to poor living conditions. Another risk factor that contributes to the heart disease would be the habit of smoking. The segregation of African American communities in New York into urban areas contributes to the rate of disease as well. Most of the communities lack access to health food. Instead of healthy food markets, they have gas stations and convenience stores which tend to sell unhealthy, high-fat, and sugary foods, along with alcohol and cigarettes, which contribute their lifestyle choices and poor health outcomes. To assess the situation, public health policies and practices are recommended. Government and health institutions organize strategies in the methods of health management for heart disease and collaborate with pharmacies in the forms of drug therapies. Reference CDC 2014. Physicians that individuals are encouraged to seek treatment for this condition would be cardiologists who specialize in the cardiovascular diseases. Other forms of treatment can also consist of alternative therapies in terms of physical fitness, nutritional guidance, and herbal supplements. Health education needs to be culturally centered, focusing on reducing the risk factor specific to non-Hispanic African Americans in New York. The stresses of socioeconomic status and psychological effect of life experiences need to be understood to help reverse the behavioral patterns of non-Hispanic African Americans in New York and reduce the rates of cardiovascular disease. The American Heart Association New York chapter works to improve the health of communities in New York to decrease the rates of cardiovascular disease. Education on nutrition, physical activity, stress and weight management, healthier kids, workplace wellness, and how to quit smoking is provided to individuals and healthcare professionals to help decrease the risk factors involved in heart disease. Reference AMA, no date. In addition, they do extensive research on cardiovascular disease to help decrease the rates of diseases and disorders of the heart. Reference AMA, no date. The CDC monitors chronic diseases such as cardiovascular disease. They provide extensive demographical and epidemiological research and information within particular areas to try to ascertain the determinants of chronic disease and ways to decrease the rates of these diseases. Office of Minority Health and Health Disparities Prevention, reference OMH-HDP. works do decrease the health disparities in vulnerable populations. Reference State of New York Department Health, no date. Chronic disease prevention for minorities is an area of focus for the office. Reference State of New York Department Health, no date. They partner with individuals, government, and other partnerships to improve minority health in New York. Reference State of New York Department of Health, no date. Healthcare professionals are focusing on the preventative care approach and the steps that people can take to prevent heart disease. The CDC recommends living a healthy lifestyle consisting of eating a healthy diet, maintaining a healthy weight according to BMI, exercise regularly, do not smoke, and limit the use of alcohol. Reference CDC 2012. Other ways healthcare professionals are educating communities on how to prevent heart disease is encouraging individuals to be open and honest with their primary care physicians, accept necessary medical treatment, and manage health by checking blood sugar, blood pressure, and cholesterol. Reference CDC 2012. Education for families is provided by the American Heart Association to help children with their families live healthier lives. Reference AMA, no date. The American Heart Association lists ways to make a healthy home, such as lists of healthy foods under $1, physical activities that can be done around the house, dietary recommendations, and portion sizes, etc. Child obesity facts and statistics, and providing kids programs with focus areas like jump rope for heart, hoops for heart, healthy way to grow, and teaching gardens. Reference AMA, no date. The New York State Department of Health runs the Healthy Heart Program. Reference HHP, New York Health Department, no date. This program works to reduce cardiovascular disease occurrence and death while making healthy choices easier to input into an individual's lifestyle. Reference New York Health Department, no date. We all know that eating right and exercising is important, but environment can sometimes make this difficult. Reference New York Health Department, no date. Some of these things that this program does to help improve communities is enable individuals to live a healthier lifestyle, are increasing and improving the number of sidewalks to encourage exercise, open schools for after hours for community use, establish community gardens, make communities safer for our children, and improving care for those who have cardiovascular disease. Reference New York Health Department, no date. HEART, which is Heart Engagement and Action for Rochester's Transformation, is a program started in the greater Rochester community to implement environmental and programmatic activities to encourage and support healthy lifestyle choices. University of Rochester Medical Center, no date. They are working to healthy living, the easier choice. Reference University of Rochester Medical Center, no date. This program was awarded a large grant from the CDC in recognition of the community's commitment to public health improvement. Reference University of Rochester Medical Center, no date. The University of Rochester Medical Center, the Monroe County Department of Public Health, and numerous community partners were awarded a 5-year, $3.6 million grant to fund HEART, the community-wide initiatives to improve the health of area residents. Reference University of Rochester Medical Center, no date. Each partner is committed to one of the following areas of focus: active living and healthy living, healthy and safe physical environments, healthy work sites, communities and schools, clinical and community-based preventative services. Reference University of Rochester Medical Center, no date. The Greater Rochester Health Foundation's 5210 Be a Healthy Hero initiative is a great reminder of daily habits that foster health in children and adults. Reference Great Rochester